Today we're connected with Dr. Andri, the Chief of Psychosomatic Clinic at the EMC Hospital, Alam Sutra. Good morning, Dr. Andri. Thank you so much for being here with us. In the morning, we're going to talk about demonic possession, or DTD, doc, in the medical science. And, with due respect to cultural beliefs, we want to see, on the eye side or other side of the coin of the science explanation of demonic possession phenomenon, or DTD, Dr. Andri.
Yeah, I know that some of the beliefs in our society considered as possession or transdissociative disorder as a part of the culturally bounded. So basically, dissociative disorders are mental disorder that involve experiencing disconnections and lack of continuity between thoughts, memories, surroundings, identity, and basically there is some of the problems related to the trauma in the childhood. So for most of the patients with DTD, or maybe what we call it in our society as kesurupan, mostly they have some mental disorders behind all the actions of trans or kesurupan. It's that.
Doc, you told us that the underlying issue is trauma, but what would trigger that trauma that makes that person to be acting that way?
Basically, when we are very anxious or have severe anxiety, we can connect to this phenomenon. Sometimes we know that people try to release the anxiety and to be someone else, or to act as a someone else, and that's the reason why people with trans or kesurupan, we call it in our society,
Yes.
can be seen as they have a traumatic event in the early childhood, basically, and they try to release the traumatic in other way. So it seems that it's very sometimes hard to understand, and we have to get some psychoanalytic for the patients, or
Right.
Helping with the hypnotherapy to get the real behind all the things related to the possessions that they have now.
Can that trauma be enticed because, let's say, of a place, or is it more of a feeling, or like you said, the roots of a fear, or they're feeling kind of anxious or anxiety? Does it also, it can, entice DTD when someone, let's say, they're in this place and they have a bad memory in that place, so then they would have a DTD or that trans disorder, doc?
Yeah. Like I said before, DTD, or the transdissociative disorder, more related to the severe trauma, because we know that in our daily life, we suffer from anxiety. A lot of patients
Correct.
with anxiety, or maybe like a depression of anxiety, and they don't have any, dissociate personality, and they can be very subtle, and then still can be they have now. And I think when they have a kind of like a traumatic, like you said, that in the place or in the trauma events, so when they see an event on traumatic event like that, and they can trigger their trauma, and they can be very anxious about that.
Right.
But not so many people will suffer or experience a trance like we say in our DTD diagnosis criteria. So it's quite different between the regular anxiety or anxiety disorder with the trance disorder, because it's very rare actually, and sometimes it's very elusive to understand also.
Doc, we've all seen that kesurupan videos, even on social
Everywhere.
media,
Right.
online, WhatsApp groups, just everywhere. I mean, one of the trait that one of the trait that we can see is that the person is talking in a different tone, in a different voice, and sometimes talking nonsense. And where does that come from?
And increased strength.
And increased strength.
They're more, have more power, doc.
Yeah.
Should have gone to the gym. Maybe.
Yeah, we know that some of the experts, also the physicians, the scientists behind all the dissociative trans disorder is sometimes just very, related to the culture bounded. But some of the memories they came up with the experiencing when they experience the transdissociative disorder, and then they can speak another language and they can speak another tone, sometimes like a a young women, and then they can speak like a grandmother or like an old lady, and then sometimes it's very confusing to us also. But we know that this brain is very powerful. They can absorb the informations that can we see in the internet, or maybe they have already seen a movie, or maybe like experiencing some of the language that they can mention. And as you say, that maybe they can also have a good strength. I know it's become the brain power, and it can relate it to the strength of the muscle also. So we know that there is an unlimited kind of a power that they have after they have a session. I know there is still the studies about this, but for some reason we know that in our culture in Indonesia also, when we see a patient with possessions, or what we call it transdissociative disorder, basically they are women, a young age, they have a possession in a factory, and sometimes it's spread, sometimes it's infectious, like an infectious other. And the other person or the other people that can infect it also women actually. So women young age, and they have some background, they have maybe emotional fatigue, and that's all the background of the possessions we see in our society nowadays.
So it seems like you just said, doctor, is very infectious, because a couple of years ago we saw this in one of the religious school, where one it seems that she is possessed, and then a couple of other girls were also possessed almost entirely simultaneously at the same time. So then that's why people said that possessions, it seems like it's very infectious. So is there any medical scientific explanatory behind this, though, doc? Because they're seeing one, then the other would follow or mimic.
Could it just be peer pressure?
Yeah, I think that's why we suggested to the schools, headmaster or teachers, when they see a patient or kind of like a victim of transdissociative disorder, we have to separate her from other crowds, from the crowd. So we don't have to see all the things, and then there is kind of like a new experience, and all the students come together and see the action, because it can be affected to other persons that has some traumatic. So I know if you see that some of the experience that we have, kind of like a emotional experience when we see a movie, and then there is a scene that can be both our memories, and it's all the same actually. So some of the the ideas behind why it's called get infected, the possessions get infected to others thing, and it's just because it has some frequencies, quote unquote, some of the frequencies are traumatic behind that, and all the things are related to the emotional problems. So our focus now is how to deal with the problems, not the possession itself, but how to deal with the problem, the emotional problems in this situation, or in this particular patients or the persons who suffer from the trans or possession is that.
Right. So, I mean, it seems, since you were talking about emotional, hence that's why it's more female, I presume, Dr. Andri, that it's more prone to DTDs.
Yes, female and young, between 15 to 20s, early 20s. So because we know there's so many examples for that kind of particular conditions, that we know in pesantren, in schools, and in some factories also. Then one of the of the staffs there get possessed, even there is no kind of the demons or kind of like a spirits that come into the body.
Right.
There's no, but only some like alterations of consciousness or alterations of the identity, and sometimes it's very rare actually in our society. But I know that it is a cultural background that support that, and sometimes it's for the patient is to release the emotional, because if there is some of the emotional problem and they cannot release the emotional problem within themselves, and then they try to be someone else, and then they can act freely or more independently from the, because when the others say that how about your experience, I know that you are now possessed with this, yes, I can see that. So you have to be very careful. Also, there's some of the people that get benefits also from the the emotional attention benefit from the possession. So I think it's a very wise to say that you have to see a psychiatrist or you see psychologist. If you see a patient or a person experience more than 2 times of trans or
in their lifetime
possessions, like.
Right.
Doc, if that's the case, so then are male and female wired differently, or is it because of the hormones? Why are female more susceptible to this condition?
There is no subtle evidence for that particular reason, but I know that there's some of studies say that maybe from the emotional background of the childhood traumatic, the female more
prone
kind
to,
of like prone to the traumatic event. So it's been because of the society and also the family. So there is no subtle kind of like evidence for that reason why it's different from male and to female.
It's from past experiences and not from physical attributes or even biological makeup.
No, not really actually, because there is no evidence that say that DTT patients or have some physical problems. Even sometimes we have to be very careful that some of the medications or actually drugs, narcotic drugs or maybe like street drugs that can trigger, just like marijuana or hashish. Sometimes it can trigger also the experience of possession. So I think you have to be careful, youngsters, to try this, kind of like narcotics, drugs, or medical substance like that. And so it's very not. I think it's prohibited for that.
That's why the medical science believes it's like male and female, but on the young adult age range, because those are the times where our emotional are very, it swings, our mood swings and whatnot.
Fragile still.
Exactly. We're not, we have not placed our foot yet on the ground. Now, Doc, just following up, is DTD or dissociative trans disorder is the same as DID, dissociative identity disorder?
Yeah. Basically, in our clinical term, in DSM-5, there is only dissociative identity disorder, dissociative amnesia, and dissociative fugu. So the dissociative trans disorder, like we said before, is more culture-bound. So seems that the identity that has very different with the society, sometimes they have kind of like a more reluctant to the traumatic event, and some of the patients with the identity, what we call it the multiple personality disorder, it's a very rare, and I've never seen it in my life as a practitioner in psychiatry after more than 13 years of practicing. Never seen a patient with multiple personality problems or multiple like we said, the identity disorder, transdissociative disorder like that. So it's very rare and quite different, but the identity sometimes it's more like they try. Some of the studies said they maintain the identity to get some benefits from them, or maybe to get some releasing the traumatic, because they don't want to be their true self. So they change themselves to another identity.
So there is, a lot of somewhat platforms and benchmark if we want to say someone is in, identity disorder
Yeah.
or even trans disorder itself. Now, from DTD, can you elevate that to another psychological disorder, or how do you, when you have your patients and whatnot having those kind of episodes, what do you actually bring up for them so that they can feel better and hopefully they're not going to have another episode of a trans disorder, doc? What do you usually do in your clinic?
Yes, as a physician, first we have to confirm the diagnosis. So it's very important for us to get the right diagnosis first, because we know that the experience that patients related to the trans or to the identity dissociative disorder can be very very hard to understand for the lay people. They can see that it is a schizophrenic patient or psychotic patients, or this is an identity personality disorder patients, or bipolar with the emotional swing. They said that this is quite the same with the identity. So it seems that they have multiple personality, but they are not. Actually, they have emotional problems, depressive or mood symptoms related to the bipolar disorder. So we have to confirm the diagnosis first, and we have to seek a treatment. There is a psychopharmacology treatment and psychotherapy treatment for these persons, and some of the patients, they have to use the medication to relieve the symptoms first, and they can gather together with the psychotherapy for certain cases.
All right, so there's many sessions that you have to undergo until you really examine, what kind of disorder that you have. And of course, hopefully that you will feel better and you live your life a little bit better too. Dr. Andri, thank you so much for being here with us, doctor. Hopefully we'll see you again soon in another discussion. It's a very enlightening one. And hopefully you have a great day today.
Thank you very much.
Thank you, Dr. Andri. We'll see you soon.
You too. Thank you. Have a great day. Thank you.